Doctors of Reddit, what was your worst quote? I don't think this is important, but patient. Had a male in his 50s walks into trauma to have his left thigh stitched up. Not an uncommon wound in an agricultural area. Speaking to him while stitching him up, he tells me he fell off a ladder while cutting a branch and the machete sliced him on the way down. Told him I was going to write him up for an x-ray of the entire leg just in case. He kept on saying he was fine. His knee hurt a bit, but logically that was from the fall. I agreed, but asked him to go to the x-ray department just in case. He reluctantly walked there and back. X-rays showed a helical fracture almost the entire length of his femur. Besides being a dangerous fracture, the femur is supposed to be the most painful bone to break, and he was walking around. Iniad had to show him the brake to get him to sit down in a wheelchair and into the hands of orthopedics. That man's pain tolerance still impresses me. Intercepted a young woman who was just hit by a car. Her boyfriend was standing with her freaking out. I do a basic physical exam and get a history and make her comfortable as we wait for the ambulance to arrive. Once the ambulance arrives, they ask for the same information, except this time the boyfriend mentions he was the one who was actually hit by the car and was shielding his girlfriend's body. The entire car's windshield was cracked by the impact of his back. He was just freaking out and worried about her and was in shock and hadn't begun to feel any pain yet. This 20s guy came into the hospital. He has a lot of conditions where he would make it past 40 and he currently had some infection. We kept giving him antibiotics which helped, but not as much as we would have liked. After about a week of being in the hospital, I walk in and I'm talking to him and he tells me that he got a medically necessary circumcision of his last admission to the hospital. I ask if it's okay if I take a look to make sure it's healing okay. It was black with all kinds of infection. I'm just not sure how a 20s married man or his wife never thought to tell anyone about this for the past week. Emergency radiologist here. I see plenty of people presenting with the understated symptoms that turn out to be mind-blowing advanced disease. The saddest one was probably the 4-year-old boy who presented with a rigid abdomen for a few months. Was told by their pediatrician it was constipation months ago, but his parents never followed up when it didn't resolve. When I imaged his abdomen, I found his entire liver was replaced with a mass consistent with hepatoblastoma. I asked the parents why they waited so long to work it up. They said they were satisfied with the diagnosis of constipation. That one left a mark on my soul. Me. Any prior surgeries? Patient. No. Me examining them. Did you know that you only have one testicle down here? Patient. Oh yeah, I had one cut out. I always ask specifically about gallbladder, appendix and testicles because patients forget about having a fucking organ cut out. Everyone at my company knows the story of the patient who came in for genetic counseling, went through their whole family history with the counselor and then concluded with, oh yeah, I was adopted as a baby and don't know who my birth parents are, does that matter? I was walking in an area with lots of Mennonites. A mom called into the clinic because a wheel had broken and one of the spokes had penetrated her toddler's eye. The reasons for the call was to ask if he needed to be seen by a doctor. She indicated that they had removed the spoke and she knew he was going to lose the eye, so was there really a reason for him to be seen? The answer was yes. Had a guy in his 50s who had been seeing an acupuncturist for an area of numbness and weakness traveling down his legs. He'd had 2 months of acupuncture for them with no improvement, so very reluctantly booked a routine GP appointment. At that point he'd started to have issues with his urination too. As soon as I started speaking to him, it became obvious that the symptoms he presented with were consistent with spinal cord compression, an absolute medical emergency. We got him straight into hospital and imaging showed cancer, with a tumor pressing onto his spinal column. Although he started treatment and stories that day, by then it was too late. He lost the ability to walk and died a few months later from the cancer. It was enormously sad and frustrating, as that constellation of symptoms would have raised an immediate red flag with anyone with medical training. Had he come in months earlier, maybe his prognosis would have been quite different. I had to take out the remainder of this guy's teeth. He was in his 60s and told us verbally and on his health history that he didn't take any meds. So I took out his last 8 teeth, all easy extractions due to infections and periodontal disease, but I couldn't get him to stop bleeding. I asked him again if he was taking anything. I finally got the clot stabilized, but it took almost an hour and I had to consult our oral surgeon. When he saw the oral surgeon a few months later about placing implants, he told the oral surgeon he was on BP medication and blood thinners. I refused to see him anymore after that. While I was a psychiatry resident, I did a graded 30-minute interview in front of my attending on a new patient without knowing any previous chart history. I spent 29 minutes collecting high-yield medical and psychiatric history, and since I had an extra minute to spare, decided to ask him more about his childhood. Well, it was pretty shitty after I watched my dad murder my mom and then kill himself. Needless to say, I did not have enough time to unpack that and failed my exam, lol. I was an internal medicine resident who had a patient come to my clinic for persistent flu. I had never seen her before and she was a healthy appearing woman in her 60s. About a month before seeing me, she was seen by her PCP with persistent coughing and otherwise had no shortness of breath or other infectious symptoms, just a dry cough. She got tested for flu and was negative, but got Tamiflu just in case it was a false negative. She had a chest x-ray which was normal. She came to me a month later because her cough persisted despite completing her therapy. Everything sounded great, heart, lungs, everything. To be honest, I don't usually do this, but something in my gut told me to feel for lymph nodes. I felt around and found something above her left clavicle. It was hard, round, and she was completely unaware of it. I thought it was probably a reactive lymph node, but just in case I wanted to get an ultrasound. This cascaded into her getting a biopsy which showed squamous cell lung cancer. A ST scan showed stage 4 lung cancer, not seen on her chest x-ray. All diagnosed because of a lymph node that almost by chance I was lucky enough to find by being thorough. I checked her chart about a year ago and she was doing well. She got therapy and was in remission after a very long road and many obstacles. I'll never forget her or her case. Was called to the ER to do a psych consult on a patient that was complaining of GI symptoms, but his story was sorta strange and he had no overt abdominal signs or symptoms. He was complaining that he suffered from Barrett's stomach, not esophagus, and had been diagnosed by a world-famous gastroenterologist. He stated that if he could lose weight, that his GI issues will resolve. I spent some time talking with him and other than this strange fixation on his Barrett's stomach, he seemed okay. Until he mentioned that his most recent weight loss method was to shoot himself in the thighs so that the leg would become gangrenous and eventually need to be amputated. This would allow him to quickly lose the 20 or so pounds needed to cure his stomach ailment. The man actually had a self-inflicted gunshot wound to the thigh from several days before. I didn't actually assess the wound because I was there for a psych consult, but did immediately alert the ER staff. I was all calm and nonchalant like, "Oh sir, excuse me for a sec, I'm gonna pop out and let another staff member know about this so they can take a look at it for you." The ER was located in a county that employed a staff of mental health social workers to place psych patients, so I had to call one of them while he was getting thoroughly physically assessed. I have no idea what happened to him, but I hope he's doing okay.